Hello, my name is Merle Kleiner, the curriculum developer for the Rural Veterans Health Access Program and proud former wife of a military flight surgeon who served in Afghanistan. I would like to welcome you to the Rural Veterans Health Access Program training module, which addresses the ongoing struggle veterans face daily with chronic pain. This video provides background information, strategies, and resources to expand medical providers' treatment options for military personnel who seek relief from debilitating pain. The statistics on veterans who face daily debilitating pain following deployment are both startling and unacceptable. According to the All-American Alternatives Organization, prescriptions of 4 potent opiates to veterans have more than tripled since 9/11. Contributing to drug abuse, addiction, and suicides, averaging 22 veterans a day. They go on to say, mixed opioid painkillers with the antidepressants and sleep aids many of our soldiers are prescribed, and you have a lethal cocktail. Our medical and mental health providers must explore and implement integrative therapies to replace the frequent, excessive, and dangerous prescribing of opiates. Fortunately, opioid use is falling among veterans. One slight improvement in pain management is that under the VA's Opioid Safety Initiative, by mid-2016, the number of veterans dispensed an opioid each quarter had decreased by about 25%. Here are a few types of chronic pain that veterans experience. Musculoskeletal pain, often caused by an injury to the bones, muscles, nerves, and/or connective tissue, is the most common chronic pain complaint among veterans. Between 2000 and 2011, approximately 5 million veterans, nearly 55% of VHA patients, were diagnosed with one or more musculoskeletal disorders. Since 2000, more than 370,000 U.S. service members have been diagnosed with traumatic brain injuries, TBIs. These types of head injuries can also lead to chronic pain, especially headaches. An estimated 15 to 35% of veterans with chronic pain have post-traumatic stress disorder, PTSD. Witnessing or experiencing life-threatening traumas or injuries can lead to PTSD, which is often characterized by symptoms such as persistent thoughts about the event, nightmares, and jitters, even months after the incident. Chronic pain syndromes are more common among female veterans. For example, musculoskeletal conditions and migraines are among the leading contributors to the health profile of female veterans and are more common in women than in men. VA guidelines for pain management suggest that practitioners consider interventions such as relaxation and breathing techniques. These can be used to address specific symptoms such as sleep, pain, hyperarousal, and anger. In addition, complementary medicine approaches can be considered as adjunctive approaches to address comorbid conditions such as acupuncture for pain. Other complementary approaches that can be included are yoga, martial arts, exercise, and medical nutrition therapy. The VA has identified 6 essential elements of good pain care. Those elements are designed to educate veterans and their families, to promote self-efficacy and shared decision-making, as well as providing access to all relevant resources, to educate and train all team members to their discipline-specific competencies, including team-based care, to develop and integrate non-pharmacological modalities into care plans, to institute evidence-based medication prescribing, including use of pain procedures and safe opioid use, utilizing universal precautions, to implement approaches for bringing the veteran's whole team together, such as virtual pain consulting. Examples are scan echo, e-consults, telehealth, clinical video teleconsultation, and education, for maintaining ongoing communication between all team members, and to establish metrics to monitor pain care outcomes at both the individual level and the population level. A recent research-based study based in North Carolina showed promising results implementing many of the VA's 6 elements of good pain care just mentioned. Results included a significant reduction of total Schedule II opiate orders. Patient satisfaction scores improved. There was a decline in opioid prescribing after distributing data to providers that compared their own opioid prescribing patterns to their peers. According to the findings, Army service members who received non-drug therapy had a significantly lower risk of alcohol or drug use disorders, accidental poisoning with opioids, related narcotics, barbiturates, or sedatives, thoughts of suicide, or self-inflicted injuries, including suicide attempts. Many organizations, such as the Defense and Veterans Center for Integrative Pain Management, or the dvcpm, are currently providing diverse methods for addressing pain management for military personnel and their families to restore their health and productivity. The dvcipm has developed a series of pain management educational videos targeting the most common issues facing providers and patients. These videos are intended to augment the Joint Pain Education Project, which was tasked to develop a common Department of Defense VA pain management curriculum for primary care providers. Here are a few other organizations. The Cohen Veterans Network provides cognitive behavioral therapy for addressing present-day problems such as managing pain. All American Alternatives is an organization that provides drug-free alternatives to help veterans cope with chronic pain, insomnia, and PTSD. The National Institute of Health has programs that can assist veterans as they deal with chronic pain. Our military personnel dedicate their lives to serve and protect our country. They often pay the price by having to contend with severe pain during and after their years of service. Fortunately, many comprehensive and innovative treatment modalities are currently available to them. As healthcare providers, it is our duty to educate ourselves about methods available and make certain our patients have access to all appropriate treatment options. We invite you to research the resources made available in our RVAP series. This is the conclusion of the Veterans and Pain Management video in the RVAP series. Other episodes include Understanding Military Culture, Screening Patients for Military History, Veterans and Addiction Medicine, and more. On behalf of the RVAP team, we would like to thank you for your dedication to the veteran population by participating in this training module. If you have additional questions, please feel free to reach out to the email shown here.